Are you having a rapid heartbeat, better known as tachycardia? When you stand up, does it get worse? When you stand up, does your heart pound out of your chest? Do you feel lightheaded, like you're gonna faint? These are all signs that there's a delay between the gates and the veins shutting, keeping blood in your head, and your body going, oh no, I'm starting to lose consciousness. And as an end result, what it does, it speeds up the heart rate. That's one. It's called, one thing that can happen is called POTS, postural orthostatic tachycardia syndrome. And then there's other people who just have a tachycardia, not when they stand up. It can happen at various times during the day. That's a whole nother issue. Both of these things can be related to the spine. In the brainstem, which is right inside the top two vertebrae and the base of the skull, there's a structure called the brainstem. And there's a center in there called the cardiac center, and its job is to control and regulate the neurological tone of the heart. So some of these cases that have tachycardia, many of the cases that have POTS, many of the cases that have fainting problems, it's due to this top vertebra structurally being locked out of its biomechanical range and impacting the cord and impacting the cardiac center. One other thing that happens when you have an upper cervical spine misalignment, the brainstem area controls the postural muscle tone. And if you look at the side of the neck, you should have a C-shaped curve like this. And when you have an upper neck misalignment, the scalene muscles typically engage, which throws the head forward, which flattens the cervical spine curve. And in response, when you have a normal curve in the neck, the head's balanced over the shoulders. Now the head weighs 10 to 12 pounds. So when it's balanced over the shoulder, everything from a postural muscle tone standpoint is great. When that head gets thrown forward, this 10 to 12 pound mass that's forward off of its axis is putting a lot of stress on the upper shoulder muscles and the mid-thoracic area. And what does the body do? It tightens the mid-thoracic area to try and keep that bowling ball, your head, upright against gravity. And in doing so, when you have tight muscles in the mid-thoracic area, that causes the joints in the mid-thoracic area not to move quite the way they're supposed to, which decreases the neurological function of the system, and the nerves that control part of the heart function come at T4 area, which is right there in the mid-thoracic area. So an upper cervical misalignment not only can cause an impact on the cardiac center at the brainstem level locally, but it can also cause a chain reaction of muscle rigidity in the mid-thoracic area, which can affect the heart also. So if you're dealing with tachycardia, you have POTS, you stand up and you get lightheaded, any of these sorts of things, it would do yourself a favor, Google upper cervical chiropractor near me, get a consultation and examine, find out if this is the root cause of why you're suffering from these problems.